challenges and biggest responsibilities is to be involved with the saving of someone's life. And for trauma nurses, saving lives is part of their job description. These real-life superheroes give their all to this job and the patients they work with. And for as long as I can remember, I've wanted to be a part of something this extraordinary. Hi, I'm McKenna Dobbs, and I have the privilege of working with and interning for a real-life trauma nurse. Come with me and I'll tell you all about it. Before I introduce my mentor, I first wanted to explain exactly what this career entails. Trauma nurses are registered nurses who specialize in traumas. Traumas are injuries that are life-threatening and require immediate medical attention. Examples of trauma cases include gunshot wounds, stabbings, and motor vehicle collisions. Trauma nurses act as the first responders of the emergency department, and they will work hand in hand with ER physicians and trauma surgeons. They play a critical role in patient care. Their responsibilities include monitoring and assessing, giving medications, along with working effectively with the doctors. To do this, they will perform primary assessment along with triaging, they will take vitals. Along with this, they will administer any medications that the doctors tell them to. They will insert IVs and take blood, and one of their most important jobs that they actually do is maintaining proper documentation and making sure that the doctors are updated at all times on the patient's condition. Now that I've explained the career, let me introduce you to my mentor. Meet Angelica Dobbs, trauma nurse of nearly 30 years. I was super fortunate to be able to job shadow her as she is very knowledgeable and passionate about her career. Angelica was an amazing mentor and was able to answer all of my questions, as well as provide me with good resources to help me complete my project. She currently works at Harbor UCLA and has been there since 1996. Angelica's background in nursing began when she graduated from high school with a passion for helping others and got accepted into Golden West College, where she was able to obtain her nursing license. After this, she got hired at St. Mary's as an ICU nurse and at the same time attended Cal State Long Beach, where she was enrolled in the nursing program to obtain her bachelor's degree in nursing. Once she graduated from here, she got hired at Harbor UCLA, where she worked as an ER nurse for many years, and in 2015 switched to their trauma department. As I said before, my mentor works at Harbor UCLA in their trauma department. Harbor UCLA is a level 1 trauma center, meaning that they have all the different specialties present at all times within the hospital, so they don't have to page for a different specialty every time they get a different trauma. Some examples of these specialties include cardiovascular, orthopedic, and neuro. Here are some images of the trauma center, and I'm going to explain a little bit about how it all works. So the trauma bay is a room inside of the ER, which is a physical building or separate wing of the hospital. And when a trauma comes in, they are immediately taken to the ER and they will be stabilized in the trauma bay. And the trauma bay has all the necessary tools and all the necessary equipment needed to stabilize this trauma patient. And this is where the patient is going to remain until they are stabilized, and then they are either going to be admitted into the ICU or the hospital to receive the rest of their patient care. Over the course of my internship, I had the opportunity of learning many different processes. The first one I'm going to be demonstrating is the process of IV insertion. IV insertion is super important in the medical field, and it's used to stabilize patients. It's also used as a pathway for administering fluids and medications, along with for taking blood samples and giving blood as well. The process of IV insertion is one of the most commonly used processes in the medical field, and it's very important. The first thing that any RN will do in starting an IV on a patient is actually to apply gloves. So that is what I'm going to do right now. And they do this because they want to first be protecting themselves and protecting the patient, and they want to make sure that they're not spreading any germs to the patient. So now that I have my gloves on, I can begin this process. All right. So the first thing that the RN is going to do is prepare and prime all of the materials. And they do this because they want to make sure that there's no air being entered into the bloodstream, because air in the bloodstream is bad and can cause some serious complications. So what she's going to do is she's going to take this saline flush and then the saline lock, and she's just going to attach it onto here and screw that on there, and then give it just a little push, and you'll know that it's you'll know that there's no longer any air in it because you'll see water squirting out. So now that that's done and that's primed, she could set this off to the side and then begin to start an IV on the patient. And the RN is going to typically look at the arm first because these veins are pretty easy to see and they're closest to the heart. And you want a vein that's closest to the heart because this is going to make sure that any medications or fluids given to the patient is going to get to the heart quicker and pumped out throughout the rest of the body faster. And in any situation, time is of the essence with trauma patients because they could be seriously hurt and bleeding out. So the first part is sterilizing. I'm going to take this sterilized sponge and just clean the area that I'm looking at. Once that's clean, I can then go on to apply a tourniquet. And they'll apply a tourniquet because this will stop the blood flow and make sure that blood isn't squirting out. And it will also make the vein kind of plumper and easier to see so that the RN isn't going in blind. Now she would take the angiocath needle and quickly but effectively insert that into the vein. Once it is inserted into the vein, the catheter will be inside of the vein and the needle will come out. So this little part is what will be inside of the vein, and then this part is actually a connector piece that will be sticking out of the skin. So once that is in there, inside of the vein, the RN can then move forward and attach the saline lock onto the catheter. And then once that's there, she can just go ahead and apply this transparent gauze and make sure that it is secured. Once the catheter and the saline lock have been secured by the transparent gauze, the RN can then move forward with the process by first removing the tourniquet. Now the RN will begin priming the bag, and to do this, they will first connect the IV line to the fluid bag, and to do this, there's just this little spiky piece that gets punctured into the bag. For this process, since I'm not actually starting an IV, it's just secured onto there for now. And then to begin priming it, all the RN would do is simply release this safety clamp right here and screw that down. And then once that is released, you would start to see fluids dripping down and removing all air. And like I said before, it's important to remove air because we do not want the patient to be receiving any air into the bloodstream because this can cause some serious complications such as difficulty breathing, and we do not want to further harm the patient. Once the bag has been applied, or once the IV line has then been primed, all the RN would do is simply attach this little connector piece to the saline lock right here and screw that in. And now the patient will be receiving all the necessary fluids and medications that they would be needing. The second process I had the privilege of learning is the process of primary assessment. The purpose of primary assessment is to determine any life-threatening injuries before moving on to a more detailed exam. This is supposed to be a rapid assessment that allows for the triaging of patients to take place, and it allows for any life-threatening injuries to be corrected and established. Primary assessment follows a list of steps that target the main causes of death. These steps are airway, breathing, circulation, deformity, and environment. In this demonstration, the patient will have just been checked into the ER and is suffering from a gunshot wound to the right arm. For this process of primary assessment, the patient has suffered from a gunshot wound to the right arm. Immediately upon their arrival, I would have applied gloves onto my hands to ensure that I am not transferring anything to them and they are not transferring anything to me. It's important that we keep this as safe as possible and as sterile as possible. I know that the patient is okay and that their airway and breathing is okay because they walked into the hospital themselves and they checked themselves in and are able to stand, walk, and talk relatively well. So this tells me that this patient is not going to die in the next 5 minutes. So I'm classifying them under the classification of urgent and not emergent. The next step in this process is to stabilize the circulation, and to do this I need to stop the bleed of her wound, and to do that I'm going to apply gauze, and quite a good amount of it, and you use the gauze to pack the wound to stop the bleeding until the doctor can get there and then continue on with a different process. So I would take the gauze and pack it tightly into the wound to make sure that the bleeding is stabilized and stops. And then I take the gauze and I'm going to wrap it tightly, applying direct pressure at the same time to slow the bleeding. And then once a good amount has been applied and the bleeding has slowed, I can finish wrapping that and then continue on with the process. And while I'm doing this, I'm making sure that the patient is alert and that their breathing and airway is still clear. I'm monitoring them and asking them if they have any other injuries while I'm going down the list of the primary assessment to make sure that there's no other disabilities and no other obvious signs of distress. And once that's done, I would have already called the doctor, and then we can determine the best course of patient care for them. And with that, our time together has come to an end. It is my hope that you were able to see all of the learning that took place in my internship. I can definitely see myself pursuing this career in the future, and I'm super excited to see what the future brings to me. Thank you for watching. Bye.